Hi, my name is Dr. Jordan Fersel. I'm a pain management specialist, and I would like to talk today about understanding chronic pain. Why do people have it, and why does it persist? And what I'm interested in having you understand is that patients have sought out for many years Western medicine as a form of treatment and cure. And when that hasn't worked, many people have looked towards Eastern medicine, things like cupping and acupuncture. And in some cases that works, but it only works temporarily. In addition, many people go to see chiropractors on a regular basis. And the question is, why do patients not get better? Why do they continue to need treatment on a recurrent basis over a period of many months and years? So chronic pain is basically an illness or a disease, and it has been, people have attempted to treat it as such for many years. The physicians that have tried to treat chronic pain are basically anesthesiologists and physiatrists, and the training that anesthesiologists have is basically to treat every painful illness as though it's a disease of the spine. In my studies and observations of many thousand patients, I have found that this approach is not adequate, and that patients require a more considered and targeted approach. What do I mean by this? In many cases, when patients sustain an injury or some trauma or even certain infections or illnesses, the trauma or the illness actually targets a particular area of the body, sometimes a group of nerves or soft tissue, other soft tissue, are basically subject to high velocity trauma, and they undergo forces, different kind of forces such as compression and stretch. And what's not recognized universally is that these forces that are coming against the soft tissue of your body basically can cause a chronic injury to the nervous tissue in your body. And when nerves get injured, that is essentially the basis for chronic pain. This is not something that's, even though it's taught in basic science in medical school, it's not something that's a concept in the minds of most physicians when they treat people with chronic pain. So we have to get in our minds that virtually every patient that has chronic pain has some disease or some damage to the nervous system. And because of that damage, what a physician needs to do is to seek out the area, to do actually a survey of the different nerves in the body that are sensory, that sense damage or that themselves can become damaged in high velocity trauma or an illness. That is the type of approach that I'm advocating, and that is the kind of approach that yields a great deal of success. To do injections such as epidural injections for discs that are herniated is not a very useful treatment, and the reason for that is that it has been found in the medical literature, but also in a lot of lay people are beginning to realize that many people, up to 50–60% of the population, are walking around with herniated discs and absolutely no complaints of pain. So therefore, what can we say? We must say that there's not a direct correlation between having a herniated disc and having pain. So I believe that the approach of looking at the individual nerves that may be irritated or inflamed and treating them appropriately is a very valid and logical approach to dealing with chronic pain. And if done this way, patients can find a tremendous amount of relief and not need to use medications such as narcotics for long periods of time. I believe that this helps to solve a lot of the problems that we're dealing with today in society. And if more doctors are trained to treat patients in this fashion, I believe that we will have much greater satisfaction and much greater success in treating people with chronic pain. Until the next time when we discuss other issues in chronic pain that are going on in the news and in medicine, this is Dr. Jordan Fersel.